In this video, I'm going to share with you the 4 signs that your back and your disc herniation may actually love bending forward. So this is perfect for you if you have some type of back, butt, or sciatica pain. You've been led to believe that every time you bend forward, the jelly shoots out the donut. Well, that's a bad thing, Charlie. We don't want that. But is that really true? Because research actually shows that in many cases, bending forward actually reduces the disc bulge or the protrusion, pushing it closer back into place. Versus extension may actually increase the disc protrusion. Really interesting stuff. So if you have this belief system that bending forward is bad, you may be avoiding bending forward, but perhaps bending forward is the one thing that you need to help you heal. So we're going to talk about the 4 signs that sort of suggest that that might be an option for you as it relates to treatment. And by the way, if you're curious as to the most likely source of your symptoms, be sure to check out my Better Than an MRI DIY diagnostic guide to confirm if a disc problem is the cause or not. All right, so the first sign that bending forward might be something that you love and shouldn't be avoidant of is that bending backwards is actually yucky. So what I want you to do is go ahead and test it, or maybe you know already, but go ahead and test it out. So there are 3 different ways we can bend our body backwards, at least with regards to the back. We can always do it with the legs too, but let's just start with the back. And I'm going to have you go through a couple different motions so that you can see, if you're not aware, and if you're watching this, go step by step along with her to see if bending backwards is in fact a yucky motion, meaning a motion that increases your back, butt, or sciatica problem. All right, so go ahead, stand, feet shoulder width apart. You can put your hands on your hips if you want, but you don't have to, and just bend straight backwards. All right, so we're going straight backwards. Awesome, and just face the camera so we can see square. Straight backwards. All right, is it yummy or is it yucky?
Yummy.
Good. Okay, well, bending straight backwards or bending backwards is not a problem for me, Charlie, because I just did that, but you forgot to check the corners, all right? So oftentimes, even if a straight backwards bend is yummy and feels safe and isn't a problem, not so fast. You're going to want to check some of the corners. So here's what I mean. So now, twist to the right and bend straight backwards that way.
That's fine.
Good, so that's yummy as well. So she's good bending backwards so far, but we have another corner. Twist to the left, bend backwards as far as you can, and that's yucky.
Yucky.
All right, and yucky, how yucky? So this is something else you want to do. So let me do this, all right? I'm going to draw this up to make sense of it, because we're going to go back and I want you to kind of get a baseline for how yucky that is, all right? So here's what we're doing, big picture, all right? The body can move forward, backwards, so forward, backward. It can tilt to the right, and it can tilt to the left, and then it can rotate right, and it can rotate left, all right? If you're watching this and you're like, hey, he's saying maybe forwards will help me, how do I know? The first sign is that some form of back bend is yucky, right? So we had her bend straight back, and that wasn't a problem. That was good, right? We had her bend back and to the right, meaning we twisted to the right and we bent straight back, and that was no problem. Then we had her check the other corner, bending back to the left, and what happened there? It was no bueno. It was yucky, right? So this area, this corner is sort of jammed. Now you could say why. It could be due to a disc problem. It could be due to a joint problem in the back. It could be due to an SI joint problem. The cool thing is even though the title of this video probably has disc in it, and I mentioned that, it doesn't really matter. So that's the good news, okay? Now, that being said, if this is yucky, I need to define how yucky so we can get a baseline. Because if we get a baseline, number 4 that we're going to talk about here at the end of the video is aimed at making this baseline or this yucky motion actually better. All right, so hang on to that for a second. So when we have a yucky motion, all right, back bend to the left, I'm going to now ask you, is that a low yucky, a medium yucky, or a high yucky? Okay, so it's medium yucky, and I'm going to put some numbers to it. So low yucky, if you're watching this and you do a back bend, you're like, it's not that bad. It's a low yucky. 10, 20, or 30. The higher the number, the worse it is. Okay, if it's a medium yucky, we're going to say 40, 50, or 60. The higher the number, the worse it is. And high yucky, it's pretty yucky, 70, 80, 90. So it's a medium yucky. Is it a 40, a 50, or a 60 yucky?
40.
All right, so we've got a 40 yucky for this left backwards bend. Now, why do I say this is the first clue that bending forwards might be valuable to you? Well, the logic is pretty straightforward. So we're going to call this like the law of polarity or the law of opposites. And this is how most people solve problems. in everyday life, but we don't apply it to getting out of pain. So this is how simple it can be, all right? If you turn a screwdriver to the right and it makes something tight, but that's not what you wanted, what do?
Turn it to the left.
Turn it to the left, right? Woohoo, right? Crazy stuff here, right? So righty-tighty, if that's not what you want to loosen it, then you go lefty-loosey. So we just do the same thing. If bending backwards is yucky, what is the opposite of yucky?
Yummy.
And what is the opposite of bending backwards?
Bending forward.
Bending forward. Ding, 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 right? So you got it. So the idea is this. If bending backwards makes you worse, then the opposite of worse is better, and the opposite of backwards is forward. Now, it might be forward to the right. If bending backwards to the left is yucky, that's the direct opposite. Or we could just say, for the sake of this video, forward might be an option for you, and it's got to be tested, and we're going to do this in sort of number 4, the fourth sign that forward bending might be helpful. We're going to actually prove it. We're going to show you how to tell immediately in the moment if forward bending is something that's useful for you, all right? So if back bend is yucky, that's the first sign. Once we find a yucky motion, either straight back, twist to the right, or twist to the left and back, then we give a score. Low, medium, high, 10, 20, 30, 40, 50, 60, 70, 80, 90. Now we have a baseline. All right. Now, the second sign, all right, that bending forward might be something your body prefers is if you'd prefer to sit and or lie down than stand and walk. Believe it or not, many people with disc issues actually hate standing and walking, and they actually love sitting, which tells me that their body has a preference for being sort of in this C-shaped position, all right? So if I were to come to you and you were to say, hey, Charlie, I have this terrible disc problem or I have this back problem and I hate standing and walking. I try to stand up and it's really painful and I have to walk forward hunched. And by the way, the more I try to straighten up when I walk, the worse it gets. And actually, the more I lean forward on a shopping cart or the more I bend forward, the better it gets. You're telling me your body likes something about being in the forward direction. Does that make sense? All right. And lying down, if that's helpful, then it tells me your body likes being deloaded. All right. It likes having the weight taken off the spine. All right. So that's sort of the second sign. If sitting and lying is a preference for you and you'd rather do that than stand and walk, and or when you find yourself walking, you tend to pitch forward, maybe that's another sign, but we'll lump that all in one. Okay. Now, what's interesting is that many people will say, in response to number 2 that I just shared, that sitting actually makes them worse. And so they'll miss it. But what they're really missing is that how they're sitting is actually putting them closer to a back bend. So let me explain. So most people with back problems, disc herniation specifically, have been led to believe they need to sit up tall, right? So what does this result in? This results in them sitting on the edge of their chair, usually without back support, creating an arch in their back, and holding themselves there rigidly in neutral spine throughout the day because they must keep good posture. All right? Or, right, maybe you've been led to believe that you need a lumbar roll or a Mackenzie support or a towel roll, right? You put that thing, you shove it behind your back, and it kind of feels good temporarily, but you're watching this video because it's not really solving the problem. Now, what's interesting, rotate chair a little bit, is that notice how I said that one sign that you like or may like bending forward or may respond to bending forward is that you notice relief of symptoms when you're sitting, right? And I kind of liken sitting to being in this slouched or C-shaped position, right? This bent forward position. But if you're sitting with your spine up tall, is the spine rounded or is it up straight? It's not. It's up tall. It's not rounded. And so that's actually moving you closer to a back bend. Your yucky motion was, and then what are you doing when you're sitting there? Pushing yourself as you're sitting, naturally. Ain't nobody sit like that, all right? Everybody sits. If you're just chilling at home and you're going to sit and you're going to be comfortable, you're going to sit like that. You're going to slouch back. You're going to let your lower back round. You're not going to be contracting your core. You're going to use back support. So maybe you said, hey, I don't like sitting. That's not good for me. But are you sitting and allowing your body to relax? or are you sitting up tall? And so if sitting up tall makes you feel worse and slouching and relaxing your back makes you feel better, then that is a sign that your body might enjoy moving in a more forward direction with regards to treatment. All right, so a little tricky there. Be careful. All right, you can sit with your back in an arch, and that might make you think you don't like sitting, but maybe you actually do. All right. By the way, research clearly shows that sitting up tall in a good posture actually causes people to hurt more. All right. Why? Because as you sit up tall, is that easy to do? Is that like you got to think about it? It's unnatural, right? Now, look, maybe some of you just obtain this position because you've trained yourself to do it. But throughout the day, like if you walk into an office and you watch people sitting, probably not too many people are sitting like that. And if they are, you know they've been told to sit like that because they have some bad back or a disc problem. And they're afraid of their jelly going out the back. All right? And so this is common, males and females, but especially females who cross your legs. And then they lean into their work, right? They're sitting up tall, kind of leaning into their work. All right? So just something to consider. We see that this is more challenging, meaning you have to contract your core muscles a lot and your hip muscles. When I say a lot, more than necessary, all right? And what happens is when you squeeze muscles, you reduce blood supply and what's in the blood, oxygen and nutrients. So sitting up tall, again, you may have been led to believe it's something that's helpful, but if it's not working for you or it feels kind of uncomfortable, that could be why. And again, slouching and shutting off the muscles might make you feel better, all right? Now, fourth thing, I think we're at number 4, all right? Let's prove it.
Wait, what was 3?
So number 3, all right, was that slouching feels better and sitting up tall makes you feel worse.
Cool. Okay, great.
All right. Number 4, we have to now prove. So Charlie, you've been doing all this talking. I can see you're really excited about what you're doing, right? But let's prove now that forward bending is something that's going to help me out. This is the best way to know if it's actually something that's going to help you out, is to actually see it work. All right. So rather than me just talking anymore, let's prove it. All right. So like we talked about, right, there's many ways you could move your spine forward. You could just do a seated forward bend. So she could sit here and she could go ahead and just touch the floor or palm the floor. And by the way, if you can't totally palm the floor, you could touch a yoga block, right? You could go down and elevate something there and just go as far as you could. Now, the first thing we want to do in order to determine if forward bending is something that we might recommend or is an option for you is that you just do 1 rep of it, all right? If you notice that doing that forward bend is painful right off the bat, like she did that, and if she was like, I don't like that, right, because it caused me back pain, butt pain, leg pain, then I'm going to say, guess what? This whole conversation, right, about forward bending, your disc might love it, whatever, my guess is that's probably not going to be the best solution for you, at least bending forward from above. There might be other options we could explore, knees to chest, things like that, but my guess is that's not going to be the best option for you because you doing something yucky over and over again is probably going to make you feel more yucky. Okay, now, let's just say that you did it, right? So go ahead, bend forward, and it was yummy. All right. Another option you could explore, even though she told me not to go this in depth, is you could go at a little bit of an angle. So if you can rotate your chair.
Oh.
So we just went forward. We just went up here. Right. Now what we could do is we could say, okay, for you though, bending backwards to the left was yucky. So what's the opposite of bending backwards to the left? Bending forwards to the right. Holy smokes. Okay, now put your hands on your knees and support yourself and bend as far forward as you can tolerate. Again, it's got to feel safe. Stop at any point if the motion is yucky. Yummy or yucky?
Yummy.
Good. Okay. And I realize the red check mark, it's not really yucky. I understand it's a little confusing, but you get the idea. Now, let's just say that wasn't good. You could also try going to the opposite side. So you kind of got 3 options here of moving your body forwards while you're in a seated position. All right. So we found a yummy motion for her. Just pick the one that felt best. If all 3 felt best, great. Just pick one, right? If none of them felt good and they all made you feel worse, cross it off. Bending forward again, not likely the thing for you. All right. So let's just say we want to go. You want to go straight forward to the left. Which one felt best?
Just forward.
Just straight forward. Good. So you're going to go ahead. We tried it once, so we know it's okay. We sampled it. Now go ahead and do 3 30-second holds. We're going to take a big bite out of it. And then we're going to do something totally crazy. We're going to see if it corrects or fixes or makes better immediately your back bend left. So go ahead. She would do 3 30-second holds. So We'll call that 30. Good. Let's go again. Second round. Good. Third round. 3 30-second holds. You just relax while you're down there. Just breathe. You don't have to do anything fancy. And now, in order to tell if it worked, we know it's safe, but will it work? Now we want to stand up and we want to have you retest. Remember when you the first sign that you might respond to bending forward was that, hey, when I bend backwards in some way, shape, or form, it's yucky. And I found that this was good, but this was yucky, and it was a 40 on the yucky scale. So now go ahead, and I want you to retest twisting to left and bending backwards and telling me same, better, or worse.
Same.
Same. Oh my gosh, what do we do? Here, take a seat. All right, so we started with the 40. Then we did this thing called the forward bend, right? Where we sat down, you did this, you're sitting in your chair, right? And we tried it on, 3 30-second holds. Then there's only 3 responses to a specific input, or motion in this case, forward motion. Either makes you the same, which it just made her the same. It didn't. When I say it makes you the same, it didn't improve your yucky back bend. And if something doesn't improve your yucky back bend, I have no reason to believe that it'll somehow help you in the future. Don't do something that doesn't work in the moment. If you change a light bulb and the light bulb doesn't turn on now, what are the chances that it's going to turn on later? Not good. All right? It can make you same, it can make you better, or it could make you worse. If at any point something makes you worse, you stop it. Again, even if it's a yummy motion, if after doing it, it makes this number go up, your yucky back bend number makes it more yucky, it's off limits. We're not going to keep multiplying yuckiness. All right? So now, it's the same. So what do we do? Charlie didn't really change anything in the moment, so am I done? Maybe. But what I would say is go ahead and tweak it. What I recommend is that if something makes you feel the same and it doesn't really work, just change it a little bit. And what I mean by change it a little bit is I like to switch from holds to reps. For whatever reason, I just found that sometimes people like holds more than reps or reps more than holds, all right? So go ahead. You just did 3 30-second holds. We know it's a safe motion. So now let's just do like 3 sets of 10 reps. So she would go ahead, bang those out. 3, cool, 4. All right, we'll call that 1 set of 10. Go ahead again. 2 sets of 10. And one more, 3 sets of 10. Great. So now she went through 3 sets of 10. She tweaked it. We went from holds to reps, and now, will the reps work? I don't know. Maybe your body likes that better. Maybe there's some pumping hydration effect on the disc that we can't see. We don't know. We don't care. We're going to see if it works. Remember, we're treating the symptoms, not the diagnosis. Go ahead. Testing her yucky.
I think that's better.
Cool. So it was a 40. All right. So if you had to give it a number, what would you give it? It was a 40.
Probably give it a 20.
Give it a 20. So 50% reduction or improvement immediately in her ability to bend backwards to the left. So better, if something's better, guess what you do? You're done. That says done. All right? So now what we do, and what I'd recommend, not only I guess this is the 4 signs your body might like bending forward, is I'd say, let's show you what to do with it now. Can we do that? Cool. Okay, so we found the motion that worked for her based off this rule of opposites, based off her story of being like, yeah, actually slouching feels a little bit better. And sitting, you're right, walking is kind of yucky, and the more I walk, the more I feel symptoms down the leg. But if I bend forward, I actually feel a little bit better. She's telling me all these forward things make her feel a little bit better. But I don't want to let the jelly squirt out the donut. You're going back to diagnostic mode. Go back to treating your symptoms. What is your body preferring? What is it telling you? It's telling you like going forward. And we just proved, test, treat, retest, that going forwards makes her ability to bend backwards. It improves her yucky motion. It makes her feel less yucky. Isn't that what we're going for here? Absolutely. Now what I would say is we take this motion and we bottle it up. That's a pill bottle, all right? And there's a label on it. And instead of being a Aleve or ibuprofen or something like that, we can take this one motion, and on the front it says seated forward bend. There's a picture of it. And that's your pill. Movement is medicine, or it could be used and or thought of as medicine. Right? Now, with every pill that you get, there's a certain dose, there's a certain frequency, and there's a certain timing of when you take it. So dose is how much you take it, frequency is how often you take it, timing is when you take it. All right? As for the dose, how much? Well, let's not reinvent the wheel. She did 3 sets of 10 reps. All right? So she's going to do 3 times 10 reps. Now, frequency, in my experience, people respond to doing this a little bit more frequently than maybe some other things. So I might say 3 to 4 times throughout the day is a baseline prescription. And the timing, do it when you know you're going to feel most yucky. Now, when would you feel most yucky? If you listen to the other signs, then you might feel most yucky when you know you're going to have to be on your feet for a while. Maybe when you get out of bed in the morning. It's very common as disc pressure is highest in the morning. And so maybe what you do is you do it first thing in the morning. Or if you know you have to take a long walk, then you do it right before the walk. Right? So if you knew you had a headache at 5 p.m., you would take the headache pill at 4:45 or 5 o'clock. You wouldn't take it at 5 a.m. All right? And so instead of just doing movement or exercise when it's feasible for you, I get that, right? The cool thing is instead of doing a sheet of things, we could just find one motion. We could teach you how to optimize the movement prescription, the dose, the frequency, and the timing, and then it becomes very feasible because you can probably do this anywhere, right? And because it's easy, it's going to get done. And because it's less, it's going to be more. Because it's going to get done, and you know exactly what makes you feel better because you proved it in the moment. So this would help you identify the one possible motion that could help relieve your pain and symptoms. Keep in mind there are other things that we need to talk about as far as sitting habits, sleeping, bending, lifting, walking. We can do more research there to identify the best solution for you, big picture. But this is potentially something that maybe you never thought or opened your eyes to that would be possible to help you. Again, because most people with disc problems have been led to believe that bending backwards is the only thing that you can do, when in fact they're not aware of research that shows that bending forwards can actually reduce disc protrusions as well. And so never rule out just based off your belief system, like, hey, I shouldn't do that, and that is good and that is bad. We don't want to label any of these things. Instead, we want to have you open your eyes to a scientific, systematic way of thinking and reasoning, and then testing these things out to find what is best for you. All right, so again, this is Dr. Charlie Johnson. Hopefully this is helpful. The 4 signs, there's probably 7 or 10 signs in there as well, right, that sort of lead you to believe or suggest or give you evidence for the fact that you may actually respond to moving your body forwards if you have a disc problem, a back problem, a butt problem, a leg problem, versus backwards. Hopefully that's useful. Let me know your thoughts below in the comments.